Hi everyone, Dinesh Sirisena here, and today we're going to be talking about imaging the peroneal tendons. As with my previous talks, I recommend two resources. First of all, the ESSR guidelines for musculoskeletal imaging, and in this case, the ankle guidelines, and also ultrasoundcases.info. And these are the images from the ESSR guidelines. So having the patient resting on the examination couch, you place the transducer in a short axis orientation behind the fibula. You should be able to then see the peroneus brevis and longus in a short axis orientation, and you can follow it down along the body of the fibula down to the lateral malleolus and around it, and you should be able to see the tendons all the way to the point of the peroneal tubercle, where then the peroneus longus goes down into the foot and the peroneus brevis then continues to attach at the base of the fifth metatarsal. You can also assess each tendon individually in the long axis if you're concerned about a specific pathology. In practice, this is how I suggest positioning the patient. So having them in a prone position with their foot hanging off the edge of the bed, it means that they're more comfortable and the ankle is more maneuverable when you're undertaking the imaging. In this position, I would use a hockey stick transducer. That's because the peroneal tendons tend to be quite superficial, and you should be able to get a good quality image using the hockey stick transducer. It's also easier to follow around the lateral malleolus because it has a smaller footprint, and also it's easier to maneuver in that regard. Remember to also assess the tendons in both the short and long axis orientation when you are concerned about a pathology. Let's say, for example, there is a tear. You want to confirm this on both the short and long axis views. And this is what you're hoping to see on both views. So in the short axis, you'll see the peroneus longus sitting almost cupped in the peroneus brevis. And as you follow it down, you'll see them become individual tendons. Now, if there's a split tear, let's say in the peroneus brevis, and the patient plantarflexes and dorsiflexes their foot, you may see the peroneus longus move between the splits of the peroneus brevis. You should also assess the tendons in a long axis orientation. And what you're hoping to see is a nice compact linear structure for the tendons, similar to other tendons such as the Achilles or tibialis posterior. If there is an area of interest, such as tendinopathy, there may be thickening, hypoechogenic changes, or if there's a tenosynovitis, maybe swelling or hypoechogenic changes around the tendon itself. Thanks for watching. I hope you found the video informative and it adds to your knowledge of musculoskeletal ultrasound imaging. If you did, please remember to hit the like down below and subscribe to the channel for further updates. You can also follow me on Twitter, Instagram, and TikTok. And remember to check out sportsmedinfo.sg. Thanks again, and I'll hope to see you all very soon.